Maybe you could sort of explain it, because what is prior authorization?
Well, John, just as I'm thinking about it, I'm actually thinking the term may be actually redundant, because it's going to get authorized to do something, or it's going to get authorized prior to doing something. So it's a term, John, which says, okay, insurance gives you certain benefits, but then to use some of them, you need to get prior authorization. You need to ask for permission and make sure that it's allowed. And it's really done for the insurers to try to control spending. So let's say they don't want you to do something expensive without having to jump through some hoops to do it.
Yeah, I mean, I think that it's ironic that it's prior authorization when if you need a prior authorization, they're probably looking to deny it. But, it was a reasonable concept. When the health management organizations, the original health management organizations were created to reduce costs, to kind of help create healthcare on a budget, to move away from indemnity care, where they historically paid for everything, they used the ability to channel decisions around very expensive medical procedures like organ transplants, experimental therapies for people who were really sick, to determine whether they were medically necessary and clinically appropriate and would be honestly worth the ROI. It proliferated in the 70s into the 80s and 90s as managed care organizations realized that the more, whether intentionally or unintentionally, the more hoops you put out that doctors and patients had to jump through, the lower the cost trend.